I really appreciate this opportunity. Just a bit about Texas Employers for Affordable Health Care. We were established last year to mobilize employers and their families and other stakeholders in Texas to rein in excessive prices for healthcare. Nearly half of all Texans, 14 million, get their health plan insurance through their employers. We want to increase transparency. We want to prohibit anti-competitive contracts in billing, and we want to increase oversight over consolidation and mergers. Just as way of background, I am a healthcare scientist, received both my master's and doctorate from the UT School of Public Health, but I wound up working in the employer space for 25 years before having the opportunity to lead first the Houston Business Coalition on Health. And I say that because we represent about 1.5 million employer-sponsored lives in Texas. And what we have learned through the RAND hospital price transparency studies is that employers in Texas in aggregate pay about 250% of a fair price Medicare rate for the same service at the same hospital by the same physician. Furthermore, research done by the National Academy for State Health Policy, or NASHP, shows that there's no need for this. Employers have long been led to believe that they pay more for healthcare because of the shortfalls due to Medicare, Medicaid, the uninsured, and charity care. The NASHP report shows that this is not true, and that when one looks at the break-even price after all costs are looked at and examined, employers are paying upwards of 200%, 100 to 200% of this. And we're not saying that what the price should be, but we are saying that there needs to be more transparency in this so that employers have a fair negotiating a seat at the table. So specifically, we are working right now to pass House Bill 711. In fact, it is being debated as we speak right now. You may have seen a link for this. As I understand, it hasn't started. More than welcome to look at that. But what House Bill 711 will do, it was introduced by Representative James Frank out of Wichita, District 69. And he introduced this bill to try to improve competition, as Dr. Gonzalez said. To have a free market, we need transparency, we need competition, and we need consumer awareness. So specifically, what House Bill 711 does is it prohibits these anti-competitive language in contracts between health plans and hospitals. And what we're talking about, and there are several, one is anti-tiering, which right now prohibits your ability to develop your networks based on value, price, and quality. Another is anti-steering, which prohibits the ability of the health plan and others to steer towards the best value providers. Again, price and quality. And the last thing that it does is prohibits gag clauses that prohibit employers and their intermediates from seeing claims data so that they can better understand value. So that's a short synopsis of 711 and why we think it's important for employers. So with that, I thank you for that opportunity.